This is Louisiana's News Leader. Channel 4's Eyewitness News Night Watch.
There's a new weapon to get rid of sun damage that makes your skin look old.
Laser technology has been around for a while, but now there's a laser that promises to give you 2 treatments for the price of 1. In tonight's Wrinkle-Free Friday, medical reporter Meg Farris shows us just how far it will turn back the clock.
At only 37, Rebecca Dufresne has a lot of sun damage from her job back in her teen years.
I chose to do it because I was a lifeguard in high school and in college, and I have a lot of sun damage, and I would like it going.
So she's in for her second treatment with the latest updated technology. It's called the dual Fraxel because in recent months it was updated to give 2 treatments in 1. The original Fraxel had a wavelength that went deep into the skin, heating up the deeper layers, so over time the healing stimulated your body to grow new collagen. You were puffy and swollen for a few days, but the top layer of the skin was never burned, crusty, or oozing.
That was used primarily for skin texture, for wrinkles, and for fine lines, and for acne scars. It also is effective for stria or stretch marks.
But the older Fraxel did not target the upper layer of the skin, so it didn't get rid of surface damage from the sun. Now this new dual Fraxel hits both layers.
The new Fraxel is called dual because you have that same wavelength that has the incredible peer-reviewed studies on its efficacy for acne scars and for photoaging. But in addition to that, there's a new 1927 nanometer wavelength that does more on a superficial level to help with that mottled dyschromia from sun damage, blotchy brown pigment, freckling, that overall sort of smudged look to the skin. In addition, it is one of the few things that seems to help melasma and have been studied for it.
You just have a redness and more peeling, but results are much more drastic.
Plastic surgeon Dr. KamranKhoobehi recommended 2 treatments for Rebecca. Before the laser was started, she had a numbing cream put on her skin for 30 minutes or so. But because the Fraxel can be very uncomfortable when the laser fires, he also offered her a nerve block like you get in the dentist's office. Those few quick injections made this her second experience with the dual Fraxel painless. You've had it without the nerve block and with the nerve block.
Correct.
What's the difference?
Huge, huge. It's no pain, none whatsoever.
So what happens when you have this new Fraxel? Well, that's what patients seem to like. A dramatic difference with only a little downtime. Rebecca says she stays out of the public for only a few days. 2
and 3 are bad, and it comes off in patches. I don't know how to describe it. It's like a lizard. It comes off, and in segments, it'll feel like sandpaper. And my entire face will turn brown, and then it will continue to come off, and when it comes off, the skin is very smooth, and it feels great.
When it comes to treating melasma with the dual Fraxel, some doctors say this helps, but some patients may also require some extra effort.
In general, to speak about facial pigmentation, I always tell patients that's one of the hardest things for us to treat. And unfortunately, I think it usually takes multiple treatments to get facial pigment better. You can use your lasers in combination with good topical treatments and also chemical peels, which I find in my hands are sometimes my best weapon against facial pigmentation.
Any laser that helps is used adjunctively with sunscreens and hydroquinone because melasma is not just from episodic sun. It really is a hereditary and ethnic thing that it doesn't ever really go away. Doctors can control it, doctors can improve it, but it's very rigid as to how disciplined you have to be to keep it from coming back.
But some doctors believe patients should use their time and money to get a more dramatic result with the stronger CO2 fractionated laser.
Actually, I'm not really impressed with this device because the device it's based on is an erbium laser, and those lasers have not been particularly effective in removing wrinkles around the eyes and the upper lip, which are the main places that we're really trying to remove them.
Quite honestly, I think we're getting closer, but we're not there yet. But this gives us another alternative. Now, is it going to achieve as much as a CO2? No, it's not. And they need to know that going in.
But the stronger CO2 laser requires much more burned wound care and longer downtime. For Rebecca, the dual Fraxel with less downtime was a better fit. So you hide out for how many days?
2 to 3 days.
And then
for me,
it's worth it.
it's definitely worth it.
For Wrinkle-Free Friday, I'm Meg Farris.
The dual Fraxel can run from $900 to $1,500 per treatment. Doctors say you get the best result with 2 or 3 treatments. That you'll see a change in pigment in a week, and the tightening and smoothing of wrinkles takes about 6 months.